I made a video some time ago about how I got my skin from this to this and to this now. That video is been like 2 years, but they're sort of like gaining more traction now, and I've been getting more questions because there was a product that I was talking about in that video that I used when I had acne, and a lot of people were asking questions about like the duration, if it worked, and what I did after that, and just so many questions like that. So I thought that in today's video I should talk about that again and my story on how I was able to clear my acne. Okay, and another reason is because I am currently working in a dermatology clinic. I also thought, well, I think this is great because I'm learning more about skin and I know a lot better than before. So let's get right into the video. My name is Ejeomah. I am a pharmacist and a digital content creator. So welcome. So when I had acne, I wasn't even sure because I'm someone that, okay, like you say, I've never really struggled with any skin disease or issue in the past. The most that I would have is maybe a pimple here and there sometimes, and that would just be it. But this particular period, it was really bad. And imagine like going from the smooth skin to like an inflamed skin. Acne is one common skin disease that actually makes you feel less confident, right? Everybody's asking questions. Oh, what happened to your face? Are you okay? That kind of thing, you know. And it's just that thing that you cannot hide. At least if it's another part of your body, it's you can still use a cloth to cover up and everything, but this is your face. You can't hide, you can't go nowhere. So I was really worried about it, and as at the time I was working in a hospital as an intern pharmacist, I spoke to some of my senior colleagues and they directed me to one of the dermatologists in the hospital. So I went to meet him, and then he recommended this Oxy-10, that's benzoyl peroxide. So, and I was supposed to use it at the affected parts morning and evening, and so that's what I did. And there are different types of acne. There's the whiteheads, there's the blackheads, there are inflammatory acne, some that has pores coming out of it, there's the deep-seated acne. You know, they're just different types of acne. I want you to understand that you having acne is not your fault. Most times it's just an hormonal imbalance that you don't have any, you can't do anything to it. It's just an hormonal imbalance, right? There can be other factors though. There's some that is due to cosmetic agents. As at the time, I wasn't sure what mine was, but looking back, it could either have been from a cosmetic agent. So for some people, it can be chemical peels. Some people, steroids. If you're building muscles and you're taking steroids, you can have that. Some birth control can make you develop acne suddenly. Even stress can cause acne, but maybe like an acute acne. So usually when someone look at me, they say, oh, you don't have large pores, so like you might not struggle with acne. But then I still got acne, right? Because I have a combination skin. If you can look at my skin now, you can see that this part is oily, but this part looks dry, right? So I have a combination skin on my face, but my body is dry, meaning dry skin. So even if acne patients are usually associated with having larger sebaceous gland, which make them secrete more sebums, but that doesn't mean that if you have a dry skin, you can't have acne. Most likely acne patients usually have oily skin, normal to oily skin. Another thing that you have to know is that the presence of acne, hirsutism, that's hair growth on your chin as a lady and everything, irregular menses, and obesity in women can be a signal that there is a presence of PCOS, that's the polycystic ovarian syndrome. So it's something that you want to take note of. So let's go to treatment. So I'm sure you're wondering, okay, what is the treatment? One, I'm going to go to the minor cases. So in my case, it was an acute acne. I was prescribed Oxy-10, that's the benzoyl peroxide with the hydrocortisone together. I mean, Oxy-5 is what I was prescribed, because it's better to start with the very minimal one. There's no need to go overboard because it just cause more side effects for you, because it can lead to burning sensations and stinging and all that. So just start with Oxy-5 if you see Oxy-5, and then apply just to the affected parts of your skin. Don't go overboard. Acne is not just to the face. You can find it on the chest, the shoulder, and your back. So it's not just limited to the face. So for your treatments, you want to look out for these products that I will be listing depending on the type of acne that you have. You know, we have already established that there are different types of acne. In my case, when it happened, I had this acne. It was acute acne I was dealing with, so it was a minor case. So if it's a minor one, you just want to go in with topical retinoids and your acids. So your acid will include, you look for any product that has salicylic acid. For severe acne, those ones that you see some deep-rooted, deep-seated acne, like they're not, you know that this one is, it's really thicker than the regular acne, those acute acne. Those one you want to go in with isotretinoin. Aside the topical agents, you also want to use your isotretinoin therapy for deep-seated acne, right? So usually most of these things will be prescribed, so it's better to go see a dermatologist. Whenever you're using retinoids, you have to understand that it's better to start with the lowest concentration, and then from there you can always go higher. The second thing is that you should not start using them every day. You start with once nightly, like once in a week, just in at night, because it's very photosensitive. So side effects of tretinoin, if overused, can cause redness, it can cause hyperpigmentation, because it's very photosensitive. So anytime you use it, you have to make sure that you use your sunscreen the next day. Go for retin-A with lower concentration, and then you can always increase if your skin can tolerate it. So it's best advised to start with 0.0025% of your retinoids. Initially, when you start using this retinoid on your face, you might notice that your skin might look like, oh, it's getting worse than before, but just don't worry. After some time, it's going to get back to normal. Just like after about a few days or weeks, to get back to the normal, and you start seeing the results. Another retinoid you can also, that is great, is adapalene. Also in the acid, you are look out for products that have maybe azelaic acid, salicylic acid, benzoic acid, glycolic and lactic acid. So lactic acid is also great for help improve the pH of your skin. Salicylic acid is great because it breaks down the scales and allows the product to enter into your skin. So it helps your retin-A to enter into the skin, but you have to break down the scales first. In some cases, antibiotics are being recommended, but some antibiotics are not recommended, like doxycycline, because it causes darkening, like really darkening of your skin, because it's very highly photosensitive. Is usually avoided. It's better to go to a dermatologist so that you can be prescribed medications that suit you and that would work for you. All right, lastly, there are also oral contraceptives that you can use for acne. So I hope you find this video useful. Make sure to leave a comment. Let's interact in the comment section, ask your questions. If you're a specialist, let me know your thoughts in the comment section below, and I'll see you in another video. Do take care of yourself, subscribe and like this video so that YouTube knows that something is going on here and will push this video. All right, so see you some other time. Bye.